Food is fuel for your body, your mind, and definitely your sport. But let's face it, nutrition is confusing, and the expectations on girls and women to be thin and have a six-pack are exhausting. If you've ever been frustrated with your body, confused about nutrition, obsessed with eating healthy, or guilty when you don't, underate, overate, or overtrained, and overwhelmed with all the pressure, then this podcast is for you. Nutrition can be easy, you can take control of it, but it might start with letting go of control by asking for help and making a change. I'm Lindsay Elizabeth Cortez, sports dietitian and owner of Rise Up Nutrition, where I empower female athletes to overcome nutrition concerns and perform at their highest level, to stop being confused by all the mixed or harmful messages, and finally have confidence in your body as a fierce, fit, and fueled female athlete. Hello, fans. Thanks for tuning in once again. I'm your host, Lindsay Elizabeth Cortez, owner of Rise Up Nutrition, sports dietitian. And today on the podcast, we have Dr. Christine Peat. She is an Associate Professor of Psychiatry at the University of North Carolina at Chapel Hill. She completed her undergraduate training in psychology at the University of Arizona and earned a master's degree and doctorate in clinical psychology at the University of North Dakota. Her internship was in behavioral medicine at West Virginia University, after which she went on to complete her postdoctoral fellowship in eating disorder research at UNC under the directorship of Dr. Cynthia Bulick. Currently, Dr. Peat works as both a researcher and a clinician who focuses on eating pathology across the spectrum, but with a distinct focus on binge eating disorder. She is particularly interested in the intersection between obesity, bariatric surgery, and eating pathology, and investigating psychological comorbidities associated with eating disorders. Dr. Peat is also a licensed psychologist in North Carolina, and as such, she treats eating disorders across the spectrum with a primary focus on binge eating. Given her background in behavioral medicine, she has also established clinical services in the UNC Bariatric Surgery Program, where she conducts pre-surgical evaluations and provides behavioral medicine interventions to weight loss surgery patients. In addition to her clinical and research responsibilities, Dr. Peat is a clinical supervisor for pre-doctoral psychology interns and psychiatry residents, and she mentors undergraduate students as well. Thank you so much for joining.
Thank you for having me. Happy to be here today.
Yes. You've done so much work in this field. Obviously, reading your bio, I think we're going to have a great conversation. I also just like to always start with just understanding your maybe just personal, like what attracted you to work in this field as you studied psychiatry and, went through training with psychology. How did you know that, working in eating disorders or that space was something that you wanted to explore more deeply?
Sure. Yeah. I'm the daughter of a physician and a pharmacist. And I think that growing up in a family where medicine and health were talked about regularly, it just sort of set a sort of consistent backdrop in a lot of ways. But I was always really interested in human behavior and what made people engage in certain behaviors, what sort of drove people when it came to their health behaviors. So that intersection between medicine and behavioral health is kind of that perfect intersection where eating disorders tend to lie. So I think it was really the combination of those kinds of experiences, those kinds of curiosities that I had that led me into eating disorders.
Mm-hmm. I love that. And I think this is great. Me being the dietitian in this situation, we think eating disorder, nutrition, dietitian, food, and yet there's so much psychology behind it. In fact, eating disorders clinically diagnosed are considered mental health disorders. And so the psychology piece is huge in there. Could you give us a quick sort of definition for our listeners of what is a clinically diagnosed eating disorder? What are the types that it could be?
Yeah, when we think about eating disorders, I think that lots of times we can get hung up on specific terms or definitions. But when we zoom out, I think really what we're talking about are conditions where individuals are experiencing challenges or difficulties when it comes to their relationship with food or when it comes to their relationship with their body, and sometimes both. Sometimes those difficulties can show up in terms of trying to lose weight or make your body smaller in a way that can be really risky in terms of your physical and mental health. Sometimes those difficulties can show up in things like binge eating episodes and then other kinds of behaviors that are aimed at maybe making up for some of those calories, like excessive exercise or self-induced vomiting, those sorts of things. I think terms that a lot of folks will be familiar with would be things like anorexia nervosa, bulimia nervosa, binge eating disorder. But irrespective of the specific types of diagnoses or the specific criteria that go into diagnosing those conditions, we're really talking about individuals that struggle in some way with their relationship with food or with their relationship with their body or both.
Mm-hmm. Absolutely. Because you have a specialty on binge eating disorder, and I have to be honest, I don't think I've talked about one, disordered eating, two, eating disorders, as well as under fueling is something I talk a lot about in the athletic world. Binge eating is something I probably haven't focused on too much, although I do work with clients who struggle with this. So I'd love to dive into this more on this episode and kind of have you and your expertise shed some more light on it. Could you first kind of describe, just for somebody who might be engaging in some of those behaviors, what that is and why? I think, frankly, from the medical perspective, like, why is this something that needs resolving? Maybe highlighting where some of the health concerns lie in engaging in this behavior.
It's a great question. And I'm really glad we're having the opportunity to kind of dive into this particular diagnosis, because I do think that there are some misunderstandings about this diagnosis and some maybe underappreciation for the seriousness of this particular condition. But when we talk about binge eating disorder in specific, we're really talking about a condition in which individuals are experiencing recurrent binge eating episodes. And I'll talk a little bit about what that means. But these are also individuals that I think carry with them a really significant amount of guilt and shame associated with their eating behaviors, sometimes associated with internalized weight stigma. These are all things that I think can contribute to some of the seriousness of binge eating disorder, but oftentimes can make this disorder one that's often overlooked. So again, when we talk about binge eating disorder, these recurrent binge eating episodes are eating episodes where people experience this sense of loss of control. And loss of control can be kind of a squishy concept to try and define. But essentially, we're talking about this experience of when someone is eating, they just cannot stop once they've started. If you imagine like a car at the top of a hill and it doesn't have brakes, if it rolls down that hill without brakes, it cannot stop itself. It feels that out of control for some people. For some individuals with binge eating episodes, they can almost describe it as like a dissociative experience where they really don't even feel like they have control over their body or what's going on internally. These individuals will have that sort of loss of control while they're eating. And many individuals will then eat really large volumes of food while they're eating. So they may eat 2, 3, 4 different meals from, let's say, a fast food restaurant, for example. And so really the hallmark of a binge eating episode is not so much the amount of food that's eaten. It's that sense of being out of control. I can't stop myself once I start. Many of these individuals will eat until the point that they become uncomfortably full. They may do this kind of binge eating in secret because they're ashamed of what or how much they're eating. And almost invariably, these individuals will report feeling really guilty, ashamed, or disgusted with themselves after a binge eating episode. So you can imagine if you're somebody who's experiencing eating episodes like this, let's say 3, 4, 5 times a week, this can take up a significant amount of your time, but also imagine carrying the guilt and shame of that every single day for weeks on end or months on end. So I think that that's part of the seriousness of this particular condition that sometimes doesn't have enough attention paid to it.
Absolutely. And I think I really appreciate you saying that the loss of the control is a hallmark of it. This might be a tough conversation, but I do experience a lot of people who throw around the word binge, and I'm not always so sure that they should. And part of it is, I think, our culture and society of really fearing overeating and making that be such an experience that is shameful, or, oh, we shouldn't overeat. And so some people start to just feel, oh, I'm full. Oh, I must have overate. Oh my gosh, I binged. Or because I went back for a second portion, that meant I binged. And that's not necessarily what a binge is. I'm not trying to say that that's good or bad or anything. Everybody's entitled to their own feelings about their eating experiences. But I really appreciate that your definition of what a binge is so that I just think in my personal experience and practice, like I don't appreciate when people throw around the word binge when they overeat, because overeating does happen from time to time. And we want to take a binge eating experience and binge eating disorder very seriously because of the effects that it can have. So those are my thoughts. I don't know how you feel about that intersection between binge eating versus an overeating experience.
Yeah, absolutely. And I think it's a nuance that really is one that's worth talking about. So I'm glad that you're bringing it up here. I think you're right that a lot of people will use the term binge eating, but really what they're referring to is maybe eating past the point where they feel comfortable, maybe eating past that point of fullness. Maybe it is just simply eating foods that they have somehow deemed wrong or bad in some way. They'll consider that a binge eating episode. But really, as clinicians, at least, when we're talking about binge eating, we're really talking about that sense of being out of control. I cannot stop eating. Even if I'd wanted to stop, I feel like I can't. Because if we just simply defined binge eating based on overeating or eating a large volume of food, pretty much everyone in the country would have had a binge eating episode at some point in their life, right? Whether it's, holidays, a celebration, those sorts of things. So certainly we're not aiming to kind of pathologize everybody in the country when it comes to their eating habits. That's part of why I think it's so important that when we talk about binge eating, we really are centering the conversation around this sense of being out of control, and that it's not just simply eating a large amount of food in one sitting. It's also not emotional eating or emotionally dysregulated eating. I think that's often another term that kind of gets lumped in with binge eating. Sometimes those things can go hand in hand and one might trigger the other, but they are distinct experiences in some ways, especially knowing that there have been so many research studies looking at binge eating disorder as a distinct diagnosis, and just the psychological sequelae that are involved, the social impairment, sometimes the workforce impairment that can happen when it comes to binge eating that we don't necessarily see with emotional eating or overeating, for example.
Yeah, I appreciate that as well. And I think this is where things do get tricky as well, because something I always say is we are emotional beings as humans. We have emotions all day long. And as humans, we also need to eat every single day. So there's going to be overlap. There's always going to be an overlap. But trying to understand the differential diagnosis is really important, because then you can seek the proper treatment. So two questions I have for you is what does treatment look like for anybody that is like, oh my gosh, this is more of a binge eating disorder that I might have? What does the process of treatment look like? And also, just real quickly, if you know statistics, if we're not diagnosing the entire country with binge eating disorder due to experiences of overeating, what percentage of people might be experiencing binge eating disorder that might need treatment?
Great question. Let me start with your second question first, and then we'll talk a little bit about treatment. When it comes to individuals who might be experiencing binge eating, there were a couple of studies done here in the US kind of looking at those prevalence estimates. And if we're talking about individuals that meet every single diagnostic criterion, so they're meeting what we would call a threshold diagnosis of binge eating disorder, we're talking about maybe 5% of the US population. However, not everyone is going to meet every single diagnostic criterion. And just because you don't meet a threshold definition of binge eating disorder doesn't mean that you don't have an eating disorder that's worth getting treatment for, or that it isn't something that isn't quote unquote serious. In fact, there was a study that was done in 2020 by Deloitte Economics in collaboration with the Academy for Eating Disorders and also a public health group out of Harvard that estimated that roughly 28 million Americans will have an eating disorder at some point in their life. So we're talking about roughly 9% of the US population. So again, these are individuals that are experiencing a range of different symptoms. They might not qualify for a full threshold diagnosis, again, meeting every single diagnostic criterion for an eating disorder, but they're falling somewhere in in that kind of continuum. So again, I think that's why, at the top of the hour, when we were talking about, how do we think about eating disorders, it kind of comes back to that point that just because you don't meet every single diagnostic criterion doesn't mean that you don't deserve help. It doesn't mean that this isn't serious. And so when it comes to binge eating disorder, just because you don't meet every single criterion doesn't mean that you don't need to necessarily work with a treatment provider, or it doesn't mean that you don't quote unquote deserve help either. When it comes to that treatment, and I think this is true for eating disorders across the board, we really recommend that people are getting multidisciplinary specialty care for their eating disorder. So let me unpack a little bit about what I mean by that.
Yes.
Multidisciplinary meaning that there are several different types of treatment providers who are involved in the care. So this will often include therapists or psychologists like myself who specialize in treating eating disorders. It would involve dietitians who specialize in treating eating disorders, doing things like medical nutrition therapy. Sometimes it involves psychiatrists who might help manage medications for anxiety, depression, things that often go hand in hand with eating disorders. And almost always it involves a medical provider to help monitor your physical health. So that's kind of that multidisciplinary approach. And the specialty piece, meaning that all of these individuals have specialty training in treating eating disorders specifically, because we know that there's a certain degree of education or training that's necessary to make sure that folks can kind of get to this path of recovery. So for binge eating disorder, anorexia nervosa, bulimia nervosa, any of the other conditions, we're really talking about this kind of multidisciplinary specialty approach for care.
Absolutely. Yeah. And going back to, again, just what you do of having that medicine background and experience, but knowing behaviorally with psychology, how much this comes into play. So we need the psychology, we need the medical oversight, and we also need the nutrition oversight. So all of that's super important. I think there's a few other myths regarding binge eating disorder that I'd love to just put out there on the table and be addressed. And I think first would be that the intersection between binge eating disorder and weight. We have a lot of weight stigma in our country, in our society. And I think that there's probably a lot of myths of thinking that binge eating disorder is the cause of somebody being in a larger body, or they are in a larger body because of binge eating disorder. But I will tell you, in my personal experience, I have seen people with binge eating disorder in smaller size bodies as well. So can you speak to just that intersection between weight and binge eating disorder and some stigmas there?
Yeah, absolutely. And I think that this is one of those things that is common even in clinical settings where, psychology professionals or medical professionals sometimes will confuse some of these terms. So one of the things that I'll commonly get asked is, isn't obesity itself an eating disorder? And certainly that's not the case. I think that many people, again, like you highlighted, also assume that if you live in a larger body, that it must be because you have binge eating, right? You just sort of assume that individual has some sort of overeating, binge eating type of pathology going on. But what you highlighted from your personal clinical experience is absolutely correct. You can have binge eating disorder and live in a larger body. You can have binge eating disorder and live in a quote unquote, sort of normal BMI type of body. There are all kinds of individuals who can be affected by this particular diagnosis. We do know, however, that the risk for binge eating disorder does increase as weight increases. Not entirely clear why. It may be that individuals who are experiencing weight stigma because they live in larger bodies may turn to food as a way to cope with some of those challenges. And maybe it turns into binge eating episodes for some of these folks. We certainly don't have causal factors that help us explain this relationship, but we have seen an increased association with weight and with binge eating disorder, which I think sometimes muddies the water a little bit if you're not sort of carefully reading some of the literature. But I think the point that you make is a really important one, that we're busting the stereotypes around binge eating disorder. And we're not assuming that your body weight, shape, or size determines what type of eating disorder that you have. I think it's a great point.
Because I can also flip it too with people in society standards of a larger body I've seen with anorexia. So it completely is regardless of body size. Now that is interesting what you said though of the association, not causation, that risk increases of binge eating with as BMI increases or weight increases. I need to clarify what you just said there, but that's interesting because I think that goes back to the stigmas and the shame and the guilt that so many people experience. If we're not feeling accepted due to our body size, and then we could be turning or using food as a coping mechanism and not, I just can totally see how that can happen from a psychology standpoint.
Well, and you can imagine how this is made even worse, where let's say you're somebody who does live in a larger body and you're struggling with binge eating. If the only eating disorders you're seeing represented in the news or frankly, even in treatment centers or other places is anorexia nervosa, bulimia nervosa, you're going to think, well, maybe I don't have an eating disorder. Maybe what I'm experiencing doesn't need treatment. Maybe this isn't a real thing. Or let's say you go to your doctor's office and say, listen, I think something is off with my relationship with food. Something doesn't feel right. You're trying to explain your experiences. And your doctor ends up saying, well, maybe what you need to do is lose weight, right?
Yeah.
You can imagine how invalidating that sort of experience might be and leads to further stigmatization, further issues of, okay, I guess my body and my eating disorder experiences aren't valid. And so I don't deserve treatment or I don't deserve help for whatever it is that I'm experiencing. So that's part of the reason that I'm really glad that you're highlighting this as a particular issue when it comes to eating disorders.
Yeah. Yeah, absolutely. Yeah. And I think just resounding message that you're saying is like, you deserve treatment. You deserve treatment. You deserve treatment. So I hope everybody's hearing that loud and clear.
Absolutely.
Hey fans, I hope you are enjoying this conversation so far, and we'll be back to it in just a moment. But first, I want to pause and let you know that this episode is brought to you by the Female Athlete System of Transformation, aka the Fast Track to overcome disordered eating and use food as fuel to perform at your highest level. The Female Athlete System of Transformation is my unique program and proven systems to guide female athletes to understanding and implementing the proper nutrition for their sport, life, and health. Myself and my team of registered sports dietitians work one-on-one with clients to address their unique needs and counsel them through the nutritional and behavioral changes needed. Many female athletes who resonate with disordered eating, mental guilt around food and body, relative energy deficiency in sport or female athlete triad, amenorrhea, repeat injuries due to negligent nutrition, or frankly, just a lack of knowledge and understanding on their fueling needs, have seen incredible success in the Fast Track. After years of working as a sports RD, I've compiled the most effective ways for female athletes to learn nutrition, be supported, be challenged, and ultimately find their success with fueling as fast as possible. So don't wait another day. Get to your goals faster by joining the Female Athlete System of Transformation. Look in the show notes or head to the website to book a free call and learn more. Okay, now let's get you back to the conversation. Enjoy.
And I think also, you have done work, and you do a lot of work when it comes to bariatric surgery patients as well. And this is incredibly interesting to me, and the intersection between bariatric surgery patients and eating disorders and the psychology. I have very little professional experience with this. I did a 4-week rotation during my schooling at a bariatric clinic. So I have very little experience with this, but I have been in years past somebody who used to watch some shows on TV that would highlight people going through the process of bariatric surgery. And I will just tell you, the pressure that they put on these people to lose a certain amount of weight by a certain time in order to have the surgery can be very, very overwhelming. And I would watch these shows on TV and just witness such scary nutrition habits because of that. So I would watch this and be like, oh my goodness, these people are just now engaging in severe calorie restriction and disordered eating behaviors, and very often not getting to the root of their eating concerns in the first place because they're so focused on getting these surgeries. So do you see a lot of overlap between bariatric surgery patients and eating disorders?
Absolutely. I mean, it's one of the things that's been studied pretty well in the literature in terms of individuals who might be a candidate for bariatric or weight loss surgery, they sometimes will have a history of eating disorder behaviors, whether that's binge eating, whether it's really significant dietary restriction, maybe it's use of laxatives or self-induced vomiting. These are individuals that oftentimes have a history of that. We also know that there's a risk of those sorts of eating disorder behaviors to happen after a weight loss surgery. And so it's one of those tensions sometimes in the field when it comes to eating disorders and weight loss surgery. I think that sometimes it sort of seems like there's a disconnect between those of us who work in the eating disorders field and potentially working in a weight management or weight loss surgery field. I think the reality is that these individuals are moving forward with these types of surgeries on an everyday basis. And one of the concerns that those of us that work in this field have is if they're not being adequately screened, if they're not being adequately assessed for a history of eating disorders, and if they're not having adequate follow-up care to make sure that those eating disorders aren't coming back, they are at real risk for an eating disorder to really rear its head because there's so much emphasis on the amount of weight that you're losing. There are huge changes in your diet, in your nutrition, in your daily activities that for some vulnerable individuals, it could almost prime you for an eating disorder. And so we think that, and these are actually best practices guidelines from many of the professional organizations, that those that are doing these sorts of evaluations have training in eating disorders to make sure that we're not sending people forward that have an active eating disorder, or if we know that there are folks that have a history of that in their past, that we're making sure that they're being monitored appropriately to make sure that this isn't something that's coming back up down the long run. Because certainly bariatric surgery doesn't sort of just take away your risk for an eating disorder. There are individuals who, may have a weight loss surgery, and here at UNC, we've had some of those folks then end up on our inpatient unit because they've lost so much weight. They then qualify for being medically underweight and malnourished. So there can be some real extremes that happen there, and certainly some things that are really scary. One thing I will clarify, though, is that as a psychologist who works in this space, really what I'm focused on are behaviors. It does not matter to me what that number on the scale is. It doesn't matter to me how much weight someone loses or what they need to do on the medical or nutrition side of things, because that's outside of my expertise. Really what I'm focused on are behaviors in which people are engaging. And these are behaviors that I think largely everyone on the planet could benefit from, right? So are you eating a variety of foods? Are you moving your body in some way that allows you to experience movement in a pleasurable fashion? Are you somebody who is getting 8 hours of sleep a night? Are you getting in enough water? I mean, behaviors that irrespective of your body weight or shape, most folks can benefit from. And so I think it's important, especially when we're talking about this intersection with binge eating, obesity, other sorts of things, that we're really zeroing in on behavior and not number on a scale per se, if that makes sense.
Oh, it completely makes sense. And I'm 100% on board with you. And very much in my practice as a dietitian, I take that very similar approach of everybody deserves to understand what kind of a foundation of good nutrition and good behaviors around food and eating, what that looks like, and around exercise as well. I think everybody deserves to understand that and learn it and try to implement that in their life, regardless of what their health status is, weight is, diagnosis is. Like, we all have our little quirks and things that might be wrong, but we all deserve to understand like what could right look like and what could healthy for me be. So looking at those behaviors is so important. So Dr. Peat, I was looking over some of your research that you've published and found a really interesting one from early 2020, which was actually in the beginning of the pandemic. So you were, I think, one of the first groups of people, obviously we don't do research completely alone, that actually looked at the impact of COVID-19 on self-reported eating disorders really early on, because I will tell you, we are still seeing the effects of it now. But back in June 2020, you were, I think, ahead of the curve there with being like, whoa, is this going to impact people? And in glancing over that study, I found some really interesting things. You did it on people in the US as well as in the Netherlands in their self-reported eating disorders. And in the US specifically, it was over 50% of the people in this study were very concerned that they would have worsening eating disorder symptoms due to the lack of structure in their life. And another kind of trigger that people were concerned about for the US was just increased time living in triggering environments. So they thought, so it was interesting because there were other things that you looked at, like, do people have less access to food? Do people have less, financial ability to go get food because of social distancing? Are they not in the grocery store? But it was actually more so the lack of structure. And those things were all part of it, an impact, but the lack of structure and time living in triggering environments that in the US population seemed to kind of be what was most concerning. I found that very interesting in that study.
Yeah. And I'm glad we're having a chance to talk about this. And you're absolutely right that the tail of the pandemic in terms of its effects on mental health is a long one, and one that we are still grappling with. And eating disorders certainly are a part of that landscape. I was able to work with colleagues here at UNC, also colleagues in the Netherlands, and also in Sweden, which wasn't published in that first round of data, but we're working on publishing it for subsequent rounds to look really at the effect of the pandemic on eating disorders. I think that those of us who are clinicians and researchers in this space understand that eating disorders are conditions that thrive in secrecy. And so if we think about, let's say March, April, May of 2020 here in the United States, things went almost overnight from being kind of a normal everyday life to being completely locked down in some respects. It was at a time when, all of our groceries were being delivered, for example. We were cautious about even walking around each other outside. Lots of folks that were able to worked from home, that we weren't in buildings in the same way that we used to be. Life as we knew it really changed overnight. And so for those of us that are clinicians and researchers in this space, I think it begged the question, how is this going to affect people with eating disorders who we know can already kind of be prone to hiding eating disorder behaviors or not wanting to talk about it? And so, our colleagues here at UNC, led by Cindy Bulik, and colleagues in the Netherlands, led by Eric Van Firth, very quickly got IRB approval to launch a survey online to get a sense of how individuals were being affected by eating disorders. And so one of the things that came out of that is exactly what you highlighted, that people with eating disorders, active eating disorders at that time, were reporting that they were concerned their eating disorder was going to get worse due to a lack of structure and due to multiple things, but due to a lack of structure and due to time living in a triggering environment. And if you think about it, many individuals, especially as they're working towards recovery from an eating disorder, need that sense of structure for that sense of stability in their day-to-day life. So I eat breakfast at a certain time, then I go to work, and then I have my snack, and then I eat lunch at a certain time, then I'm wrapping up things at work, and then I might go home, have a snack, do a couple of things with the kids, whoever it might be, make dinner. You kind of have these different touch points in your day. When we went from that to spending basically every moment at home, you don't have that same sense of structure. A lot of people may have been out of work for an extended period of time. So they're not even working from home, for example. So that social structure drastically changed for a lot of folks. I think also what we heard from folks is that they may have had to move home. They may have had to move in with individuals because of financial constraints. Maybe they lost their job. If these are college students, they may have been living on campus and they had to return home, for example. And some of the things that we heard from participants was that wherever they went to sometimes was a more triggering environment than they were in before. So maybe they're around family members or friends who made comments about their body. Maybe they were around people who weren't supportive of them being in treatment for an eating disorder, for example. And so the combination of all these sorts of experiences had people concerned that their eating disorder might get worse.
Yeah, it's so interesting. It makes so much sense. And quite frankly, it's just so sad. Everything with COVID-19 pandemic wasn't and still is sad, but the way that it impacted eating disorders was really shocking. And that was so early on that people were feeling that way. And then it was like 2 years later, we saw eating disorder numbers really skyrocket. I don't have those numbers on hand. I don't know if you know them. Do you know off the top of your head?
One of the things I do have off the top of my head is that children's hospitals, children and adolescent hospitals that were treating eating disorders have seen double the case volume since the onset of the pandemic, where you can see a very clear line that just goes straight up after, let's say, March, April of 2020. There were some data that were published out of Boston Children's Hospital and also the Children's Hospital at Ann Arbor, Michigan, where their numbers have just increased at least twofold. And I don't know that we see a real end to that at this point.
Yeah, I agree. Literally double. And that's what I'm seeing too, just completely anecdotally. But I'm like, okay, we're, it's 2022, nearing the end of 2022, and I'm not seeing those numbers slow down, which is really interesting. So I'm not sure, maybe another study needs to be done as to why the numbers aren't coming back down when structure is back in place. Children are back in school. I'm not quite sure why the numbers aren't coming back down, but I think it definitely highlights environment and structure. And this is just an interesting conversation that I have a lot with people, is that structure versus freedom, right? The structure of meal planning, nutrient timing, versus the freedom of I'm going to eat what I want and be intuitive. And there's benefits to both during certain situations, right? It's to each their own. Individualization. It's, are we recovering from an eating disorder? Are we recovered? Are we disordered eating? Are we normalized eating? Whatever that may be. Like there's no one answer that's going to fit all, but it's what's going to work for you during this time. So there's benefits of structure with nutrition, and there's also benefits of freedom with nutrition. But that structure, I know, can be super important during eating disorder recovery specifically.
Yeah. And, one thing to keep in mind when it comes to this particular study is that the vast majority of people that were responding to our online survey were people that were actively struggling with an eating disorder. So that structure, like you said, may be more important for those individuals who are actively struggling versus those folks that are working towards recovery or maybe have been in recovery for a number of years.
Mm-hmm. Mm-hmm. Very interesting. One other thing I just wanted to shed light on is your work with the National Eating Disorder Association, and they're in Chapel Hill or in North Carolina, the National Center of Excellence for Eating Disorders. So can you first tell us about the National Center of Excellence for Eating Disorders, which is in North Carolina where you are, and kind of what is the mission there and the work that you do?
Yes. So the National Center of Excellence for Eating Disorders is what we commonly refer to as NCED, was established in 2018 through a grant funded by SAMHSA, the Substance Abuse and Mental Health Services Administration. This is the first federally funded center of excellence dedicated to eating disorders. And the entire mission of NCED is to provide education and training on eating disorders. So we're not a clinical shop. We're not a research shop. We're an organization that is entirely devoted to training healthcare professionals, the general public, the community about eating disorders. This came about actually from a piece of legislation called the Anna Weston Act. The Anna Weston Act was named after a young woman who passed away from her eating disorder. Her mother, Kitty Weston, worked tirelessly for 16 years to get the first federal piece of legislation on eating disorders passed. It passed through the Mental Health Cures and 21st Century Mental Health Reform Act. In any case, the idea is that with the Anna Weston Act, healthcare providers had to receive education and training on eating disorders. So in many ways, NCED is the living, breathing embodiment of the Anna Weston Act.
Wow.
And so we have been really privileged to be able to do this work and to be able to train all kinds of healthcare professionals about eating disorders so that folks with these conditions have a broader range of individuals that they can go to and know that they've had at least some education and training on eating disorders.
Mm-hmm. It's so helpful for all healthcare providers, no matter what field they're in or types of clients they're working with, to have knowledge, because as you mentioned earlier, that statistic, where did I write it down? 9% of the US population will have an eating disorder at some point in their life. So awareness and education is so, so important. And then can you tell us a little bit about your work with NEDA as well, the National Eating Disorder Association?
Yeah, absolutely. So in this actually, was it this year? I think it was this year. I joined their research advisory board. So many people are probably familiar with the fact that NEDA funds different research grants, looking oftentimes at treatments for those with eating disorders, or sort of innovative approaches that might help expand treatment to individuals who are commonly overlooked for eating disorders or don't have access to care. And so I've joined their research advisory board to help review a lot of those applications that come in, help kind of figure out what's going to have the most impact, help move the field forward. And so that cycle cycle actually just opened, I want to say a couple of weeks ago, and those applications will be due here later this year. So those of you that are interested in submitting an application for this type of research funding, definitely check out the Feeding Hope Fund. That's what they refer to as their research grant fund. And those will be reviewed towards the end of this year.
Amazing. Amazing. So much good work that you are doing with the National Center of Excellence, with NIDA, and of course, in your practice as well. So thank you so much for having this conversation, educating us on eating disorders, binge eating disorder, shedding some light there. And Dr. Peat, I end every podcast with the same 4 questions for all of my guests. So I want to ask you the same ones as well.
Great.
More personal ones. If there was one food you could eat every single day for the rest of your life and never get sick of it, what would it be?
Eggs. Easy answer. Eggs. I would eat eggs and do actually eat eggs almost every single day.
There you go. You're already doing it. I love it. Do you have a favorite sport to participate in yourself?
To participate in, I would say softball. I played softball in high school and then sort of in graduate school on co-ed leagues, those sorts of things. Yeah, it's a lot of fun. I'm left-handed, so playing first base it comes as a little bit of an advantage there.
Yeah, I like that. Amazing. And how about as a spectator? Do you have a favorite sport to watch?
Despite some of the understandable controversy, it's football. I love to watch football. I'm a big college football person, have been for a long time, although I would say a very close second is college basketball.
Yeah, especially where you are at UNC.
Yes, absolutely.
I was actually surprised when you said football. I was like, oh,
I
wow.
know it.
Okay, and then since this is the Female Athlete Nutrition podcast, do you have a female athlete, whether somebody well-known, professional athlete, or just in your personal life that you want to give a shout out to for being a role model and being an inspiration to other female athletes?
I would love to give a shout out to my colleague and somebody I actually went to undergrad with. Her name is Jenny Shannon, Dr. Jenny Shannon. She is the director of the mental health services within UNC's sports program. So she heads up she's the sports psychologist for UNC. That's probably the most concise way to say it.
Yeah.
She has been a sports psychologist for the entirety of her career. And one of the things that I really appreciate about Jenny is that she is a former athlete herself, and it actually is still a continuing athlete. She runs and bikes and those sorts of things, but she was a gymnast in an earlier part of her life. She has done such an excellent job about highlighting the mental health component of sport, and most importantly, the risk for eating disorder among those that play sport, especially at the D1 level. And so I think she's just such a champion for making sure that student athletes in particular are taken care of as whole human beings and not just in their sport. And I think that she's done a lot to really help reduce stigma around mental health for athletes.
Amazing. So shout out to Dr. Jenny Shannon for all the work she's doing for athletes in their psychology. And thank you so much, Dr. Christine. You have just really educated us, and you're doing amazing work in your field, and you're helping and you're changing lives. So thank you so much for joining us for today's conversation.
Well, thank you so much for having me. It was a pleasure to talk with you about all things eating disorders.
I really hope you enjoyed that episode, and thanks for listening. But before I let you go, I have free resources that you can have access to right away, right now, so that you can start fueling your body as a fierce, fit, and fueled female athlete. First, I have your Red S recovery race. If you've ever wondered if you might be struggling with Red S, curious to learn more, or know you have Red S and are looking to recover fast, then you can head to www.riseupnutritionrun.com/RedS and download the Red S Recovery Race. See how you place and figure out the next steps to recovery. Plus, while there, I have a few other great resources for you, including 3 nutrition secrets that every elite athlete swears by, and access to our private Facebook community, Female Athlete Nutrition. So again, to gain access to all of this, head to riseupnutritionrun.com/RedS. That's /REDS. And you can gain access and get the help you need fast. Too many girls and women and female athletes struggle with nutrition, but you don't have to any longer. Become fierce, fit, and fueled. Links in the show notes, and I'll see you next time.